We're all living through a historic moment. NASA scientists say this July is likely to be Earth's warmest month on record in hundreds, if not thousands of years. How is this affecting our physical and mental health? What solutions do local leaders have?
We are living in a much different summer. It's not your grandmother's summer. It's not even the summer from 10 years ago, because we know the heat waves are more frequent. They're longer in duration, which means our bodies are less likely to recover if we don't have refuge from the heat.
Our guest today is the Chief Heat Officer for the City of Los Angeles. Marta Segura is leading the nation's second largest city in a search for solutions while keeping equity at the forefront of their efforts.
And if you frame it not so much about climate, but public health impacts on themselves, their family, their community, I think that it becomes a much more personal issue, and it becomes a much more important issue when they recognize that it's impacting their community's health or their health.
And this is Conversations on Healthcare.
Well, welcome, Marta Segura, to Conversations on Healthcare.
Thank you so much. Thanks for having us.
Yeah, you're joining us at a very important time, as heat is really the leading weather-related killer in the country. And according to the EPA, we heard you speak at Aspen Ideas Health Gathering. But let's start by giving our audience understanding, what does it mean to be the Chief Heat Officer for LA? And just out of curiosity, do you have enforcement powers?
Great. Okay. Yes, I'll start with what the role is. I have a dual role, actually. I'm the Climate Emergency Mobilization Director, and that was my first role here at the city. But then, of course, there was this acknowledgement and discovery that extreme heat was LA's primary climate hazard, is LA's most dangerous climate emergency. So the council, in their wisdom, decided to designate a Chief Heat Officer. So the question really is, what does a Chief Heat Officer do differently than a climate officer? And I would say that we deal more in the realm of public health and public safety. I work much more closely with our emergency management department on disaster response and emergency management, and then prioritizing extreme heat as one of the primary emergencies and disasters to prepare for. By being an advisor in steering committees and task forces that identify resources like cooling centers, hydration stations, resilience hubs, shade structures, more tree canopy, to both have a better deployment of resources where they're most needed, but also to create mitigation and adaptation for the long run. So it's a great fit for me personally, because I have a master's degree in public health. So for me, the main reason I got into environmental health, environmental policy, was to improve the health of communities. So it makes a lot of sense to me to integrate climate, equity, health, and disaster response.
Well, it's such a good fit in terms of a clear and clean title. For sure.
Mm-hmm. Well, Marta, I know you've been in this role about a year or so, and lots of projects underway. One of them was titled Heat Relief for LA. I have a feeling many of the things you just talked about probably have been incorporated into heat relief for LA. But tell us how it works and what other dimensions does it have, and how are you launching this or delivering it to the community?
Sure. We had a launch with the mayor's office, with LA County and the state of California. And one part of it or aspect of it is a broad-based social media campaign with over 100 nonprofit partners, but we have also included businesses on that. The other part is creating materials and curriculum and posters to distribute to some of those same nonprofit partners, but more widely throughout the city. In addition to our city departments sharing that information. The other aspect is we're collaborating with Metro, the bus system, the train system, and very soon they will have this information inside their buses, outside the buses, at the bus shelters, on some bulletin boards. So we're trying to make this as ubiquitous as possible to put heat at the forefront of how people create habits of care for themselves and for their community, so that there's a recognition that we are living in a much different summer. It's not your grandmother's summer. It's not even the summer from 10 years ago, because we know the heat waves are more frequent, they're longer in duration, which means our bodies are less likely to recover if we don't have refuge from the heat. So we're trying to instill in these better habits of care so people can know what to do, but also recognize the symptoms. So all of this is a public awareness campaign, but also we're compensating some nonprofit organizations that already have community health educators to share this information with the more vulnerable communities, because as we know, vulnerable communities have greater rates of chronic illness. They live in more polluted areas. They live in areas with less access to thermal comfort or air conditioning. And that's why we see higher rates of emergency room visits and also premature deaths in those areas. So we are trying to make it as comprehensive as possible. And it's our first year that we've really launched this, but we hope to learn a lot of lessons this year and continue to increase that communication. And I also want to point out that it's part of any healthy early warning system to have this kind of a campaign, because you don't want to just notify people 2 days in advance that there's going to be a heat event. You want people to know the significance of that heat event by having this kind of early communication and awareness building, so people actually know what to do and how to prevent heat injury.
Great.
You know, Marta, speaking of learning lessons, there are a few other chief heat officers across the country in cities like Phoenix. I think Phoenix had 20 plus days of over 110 degrees, and Miami, another city that has a chief heat officer. But you're the first Latina to serve in such a role. How are you using this really unique platform to reach the vulnerable populations in LA?
Yes, no, that's a really good point. I think part of my drive and motivation is the fact that I come from a family where my father was both a farm worker and a construction worker. My mother was a cannery worker. So they would tell me about the fainting, the injuries, the deaths, the accidents that would happen as a result of heat exposure, right? So it's a driver for me. And one way that I'm addressing that as a public official is I'm bilingual. So I can do interviews in Spanish. I can write up narratives in Spanish, but we have a multilingual campaign. So I'm sensitive to the fact that other vulnerable communities, maybe not as large as the Latino community in Los Angeles, but Korean, Armenian, Tagalog, Chinese are all part of our campaign. And we're also partnering with organizations that serve those communities so that we can get this information out to them. And in fact, we're also partnering with indigenous communities from both Mexico and Central America, because they have very different languages as well. But fortunately, there's an organization here that has the expertise to translate this information into that language. So I think that experience has made me a lot more sensitive to how important it is to have this information available in various languages, and really careful about how we create strategies to reach these more difficult to reach communities that aren't traditionally part of, the broader civic engagement that we have in Los Angeles.
And Marta, are you working with these other chief heat officers? Do you have an association, or is it more informal right now?
Yeah, well, with the Miami and Sierra Leone, there's like 8 women chief heat officers. We have a cohort, right? And so we just had a meeting this morning, for example. Many of us are going to a retreat in September. I won't be able to make it because it's our peak heat season, but we're all meeting in Nairobi. Last year we met in Washington, D.C. With regards to David Hondula, in Arizona, we meet pretty frequently. We're on a couple of cohorts ourselves. And then in addition to that, we serve on panels for one another. I invite him to be on panels with LA, and I really respect the work that he's done there. And in fact, I've learned a lot from Miami and Phoenix and other offices that have already implemented heat planning into their city plans. Yeah.
Great. Well, so, Marta, as in so many health equity issues, poverty rears its head here. A study found that areas with higher rates of poverty had temperatures 7 degrees warmer in the summer compared to wealthier neighborhoods. And, it may seem obvious to some folks what those contributing factors might be, but we would love to hear from you. What are the equity issues with heat, climate change, and why do they exist?
Great. Well, I think the easiest way to explain that is that in most cities, there was redlining and therefore subsequent historical disinvestment, because those redlined areas by legislation were not receiving the capital investments that other areas were receiving. And those areas were also where we put the manufacturing, the polluters, the refineries, the oil drills. And so that's what made that real estate less desirable and also less expensive to live near, right? So those are contributing factors to why there is more chronic illness in those areas and why there's less tree canopy, why there is less public infrastructure, green space, green streets, open space. We're trying to catch up, I think. We're trying to catch up in most cities, but it's there's a lot of catching up to do, over 60 years of catching up to do to ensure that we have healthy, thriving communities everywhere. The other part that I want to mention is that heat exacerbates and stagnates pollution and smoke. So if you have pollution in these areas and you have wildfire nearby, those two are exacerbated. And what that means is in our breathing zone, our near surface temperature, we're more exposed in those areas to longer, greater rates of pollution. And so, and if those bodies are compromised already by chronic illness, whether it's diabetes, obesity, heart disease, kidney disease, it has an even greater impact on people with those kinds of chronic illnesses, because heat can denature our circulatory system, right? And once it starts to do that and deoxygenates our system, then that's what puts us into the risk zone of exhaustion and heat stroke. So we want to be able to tell these communities, look, you're even at greater risk, even if it may not be as hot as it is in some parts of the desert, because you have this pollution level, because you don't have amenities like tree canopy and shade structures while you're walking from school to home or from home to work, etc. So those are all, and then there's food and diet, right? I also like to point out that caffeine, coffee, soda, alcohol, all dehydrate our bodies. So if you're a construction worker that lives in one of these areas, or even just anywhere in the city, and you had a beer the night before, you drank 3 cups of coffee before your workday starts, you're already starting at a disadvantage, right? So then there's that. I guess I brought that up because there's a awareness and educational disadvantage, because we have food deserts in these areas, and people tend to rely on sodas to refresh themselves, or iced coffees to refresh themselves, or a beer, and those going back to the habits of care. If we really want to care for our bodies, we need to reduce the consumption of those, particular during heat season.
Great. We're speaking today with Marta Segura, Chief Heat Officer for the Los Angeles. Marta, I'm wondering about how you're able to address some of these issues that have a significant cost associated with them. I'm wondering how Sacramento and Washington, D.C. are helping out, because some of these historic problems really require investments by state and local as well as national governments. What are you seeing that gives you some hope?
Well, I'm seeing more resources in the state of California being allocated for climate adaptation, climate mitigation, and in particular, extreme heat. And the state of California is taking a very proactive stance on extreme heat and creating legislation around it and funding various departments like the Office of Planning and Research, Cal OES, even their Department of Public Health have all received resources to not just redistribute to cities, but also participate in broader reaching campaigns across the state. So that's hopeful. I've also seen FEMA change their guidelines to include climate hazards in our local hazard mitigation plans. And in Los Angeles and in other cities, extreme heat is that primary climate hazard. And so we're creating a special report in our local hazard mitigation plans to address the gaps, to address the deficiencies that we still have. And those plans not only serve to guide LA on what to do, but they're advocacy tools, and we can use them to show the state and the federal government what still needs to be funded, right? And so at the federal level, of course, you've heard of IRA, the Infrastructure Investment Act, and we want to make sure that in the city of LA, we receive our fair share. So we have a chief administrative officer who is also our capital climate investment czar. So he's going to be tracking and monitoring all of these federal investments and sharing them with various departments, whether it's sanitation or public works, emergency management, planning department. So each department can apply for these available funds for the city of LA. And so for me, that's hopeful. And the other part that's hopeful to me is that the city of LA has an equity index. So we're trying to align that equity index to monitor and track our investments, but also align it with Justice 40, the Biden administration initiative that basically tells cities to invest no less than 40% of these climate infrastructure investments in communities that are vulnerable. And he calls them environmental justice communities specifically. So all of this has to work in concert. And I think Los Angeles is at the forefront of some of those needed changes to ensure that the money goes where it needs to go.
Right.
Great. Well, certainly we want to keep an eye on what you're doing because the rest of the country isn't far behind. This has been a summer where we saw record-breaking heat spikes all over, even in the East where we are. But I wanted to ask you, sort of addressing both the equity issue and the health impacts of heat. Research also shows that there are greater mental health issues as the temperature increases. Some research showing that Black and Hispanic people may experience greater mental health issues secondary to the heat. That calls for a whole different response, perhaps, or an additional response, particularly, I would think, from your public health and law enforcement and civic employees. What are you doing to address that issue?
Well, fortunately, in LA, we have the County of Los Angeles, and they have a Department of Public Health, but they also have a mental health division. And so we're going to be working much more closely with them to ensure that this information gets out through their promotional materials. But we also want to work more closely with hospitals and clinics to not just identify when people come in for heat stroke or heat injury, but if people are coming in because of increased anxiety, or they're at the hospital because there was an incident that involved mental health issues, that there is a correlation being made with the possibility that it was caused by extreme heat, right? So we want to make sure to create the collaborations that we need to address that issue more seriously, but also build the awareness so that people know that this could be the reason why they're having more incidents during the summer. And in these communities that you've mentioned, like the Latino communities, the Black communities, and in LA, they're one and the same. Latinos and Black communities live together. There could be an increase in violence, right? And crime. And that's where we need to work with law enforcement to have this recognition that, during areas of extreme heat, maybe we want to do more in advance to ensure people are safe and that they stay cool and they have areas of refuge, and then monitor and track whether those kinds of investments are also having a positive impact on that metric.
Mm-hmm. Well, you mentioned clinics, and I know the federally qualified health centers across the country. This is a very important issue for them and are working hard. You know, probably the rest of the country looks at LA and says it's a very progressive community. But the reality is you're dealing with climate change deniers all the time. Wondering how you manage the pushback that you're getting, and any advice for others as they're thinking about this conversation that needs to take place with every member of the community.
Yeah, I really think that engagement is a key part of it. Having not just conversations, but focus groups like in person, so that you're not just asking people questions, but you're having a conversation with them about what they think the solutions are. And if you frame it not so much about climate, but public health impacts on themselves, their family, their community, I think that it becomes a much more personal issue, and it becomes a much more important issue when they recognize that it's impacting their community's health or their health. So I think that's another reason why framing it as extreme heat, not just as a climate emergency, has been super helpful across the nation. I had a conversation the other day with the climate director in Mobile, Alabama. Her name escapes me now, but you would think that, you know, in Alabama, she wouldn't be having much success, but she's having quite a bit of success because of her public engagement approach. Mm-hmm. And she's even tracked, Latino, African American, and other ethnic groups in their responses on how they feel about climate change and how they feel about extreme heat. So maybe the politics are still very, challenging and difficult in those areas. But when you talk to people are concerned. People do want to remedy the challenges before them. And if they build that awareness and they build that muscle to know that there's a correlation between extreme heat and public health, I think it becomes a lot easier to deal with. And then the elected officials in those areas could get more, pressure to make the changes that are necessary. Yeah. And you haven't brought up Texas, but Texas is a good example of where I believe people are very concerned about their health, want to do something about it, but the governor obviously diminished the guidelines for breaks for construction workers, which is devastating because that will result in more death.
Well, Marta, I know the CDC has estimated over 700 Americans die from heat each year. I have a feeling that's probably underreported as in terms of contributing factors. And I actually was just over the last few days with lots of different groups from around the country that are engaged in training healthcare professionals, and several of them were actually from the LA County Health Department. You were well represented at the meeting. But I'm curious, as you do your master planning, are you working to try and incorporate training around addressing the impact of heat on? Are you trying to impact the training of health professionals to recognize it, to understand it, to counsel people? Is that working its way through the curriculum as well?
Yes, it is for us, and we've already begun to develop curriculum for all of our city partners. And I will say that the Department of Health and Human Services has reached out to our office, the state, these federally qualified healthcare providers, hospitals, and we're going to be having a meeting next week to talk about not just the training that will be necessary, but the data that will be necessary and what data gaps still exist and how we could expedite the collection of that information to be much more resourceful and efficient in how we're tracking the improvements from the investments that we're making. And I'd like to point out that Dr. Eisenman at the UCLA School of Public Health created this heat map, which is basically a heat risk map that points out excess deaths and hospitalizations across California, right? And it demonstrates that in these areas of vulnerability, you obviously have far more emergency room visits. I think he tracked that 1,200, there's 1,177 on average more emergency room visits in these areas of vulnerability per heat wave, right? And not all of those result in death, but it's just an indicator of how much more we need this data and this collaboration with clinics and hospitals. So I'm glad to see the Department of Health and Human Services taking this leadership role. So I want to thank Javier Becerra for that. I know he was somebody that you interviewed earlier, but they are taking that proactive role and being more involved in how municipalities and states can accelerate those types of trainings and solutions.
Marta, you've got the opportunity here on Conversations on Healthcare to talk to leaders in all 50 states, the District of Columbia, and the territories. I'm wondering what recommendations would you have for cities and towns should they embrace the idea of a heat officer?
I would say yes, because when I was hired as a chief heat or designated chief heat officer, it gave me additional responsibilities, but it also gave me additional authority, right, to be an influencer, a policy influencer within the city of LA in areas that I wasn't already a part of. So there is definitely an added value to having somebody who is just dedicated to extreme heat as a climate emergency to ensure that it is not the silent killer for their municipalities. And it in my experience, the media has been much more interested in discussing extreme heat as a public health issue, more so than climate, right? There are experts in that area there, but for some reason, extreme heat, I think, became a priority for our city because of the public health threats. So if your city wants to address this and wants to accelerate solutions, it does help to have one leader to unsilo, collaborate, and coordinate these different entities, agencies, and plans within your municipality so that you can create a more comprehensive solution that affects those various areas that I've mentioned, whether it's public health, public safety, emergency response, and climate adaptation and climate mitigation. Mm-hmm. I've seen a big difference between these two roles.
Great. Marta, some things seem so obvious, right? Increasing the tree canopies, having cooling stations, water stations, maybe talk in a moment a little more about protection for workers, which you raised, which I think is very essential. But we also, we're reading about some kind of high-tech ways that might help to mitigate this. I've read about special white paint to reduce the sun's effect, shielding shields to block the sun's radiation. I would imagine all of these ideas cross over your desk. Are there ideas coming that are maybe not so common sense basic, but that take advantage of new technologies or new products that you think might be part of the armamentarium to try and fight this?
Yeah, I'm a big supporter of cool roofs, which uses this cool seal material that you're mentioning. I'm also a big supporter of using AI to identify where we lack tree canopy, where our cool roofs are. Google just came up and is going to be presenting or launching sometime this week this analysis of cool roofs throughout LA County. So now we're going to be able to use that in our building electrification strategy, right? Because building electrification also means weatherization, energy efficiency, and reducing the urban heat island effect overall. So, and it doesn't just come across my desk. In fact, it's an item or an investment that goes directly to the Bureau of Street Services, because the Bureau of Street Services then actually is the one implementing the tree canopies, the bus shelters, the cool streets, right? Yeah. We have seen more research that shows that cool streets are more effective when surrounded by shade and shade structures, bus shelters, tree canopy, because the radiant heat emitted by cool streets can affect the pedestrians walking by. So we want to minimize that effect of that radiant energy on pedestrians, especially on hot days, right? So I just want to point that out. And there's more research emerging on cool streets, but cool roofs undeniably is a way to reduce urban heat for buildings and for cities as a whole.
Well, that's great. Well, thank you, Marta Segura, Chief Heat Officer for Los Angeles, for your environmental leadership. And we also advise everyone to stay cool and healthy right now. And thanks to our audience. Be sure to go online at chcradio.com to sign up for our email updates. Marta, thank you so much for being with us today.
I really appreciate you both. Thank you, Margaret, Mark, everyone.
Thank you, Marta. Thank you for your wonderful work.
Continued success. We'll follow your trajectory as you move forward on this really important area.
Absolutely.
I appreciate it. Thank you so much.
All right.
Bye-bye.
Thank you. This copyrighted program is produced by Conversations on Healthcare and cannot be reproduced or retransmitted in whole or in part without the express written consent from Community Health Center, Inc. The views expressed by guests are their own, and they do not necessarily reflect the opinion of Conversations on Healthcare or its affiliated entities.